welcome back to the channel. I hope that everybody is doing well today. If you are new here, then hi, my name is Brittany. I am a nurse practitioner and all of the content on this channel is dedicated to nursing content. I am also a small business owner. I created the Brittany Holzbeck NP Review, which is a review course for nurse practitioner students going for their licensing exam. And I've actually helped thousands of students pass their licensing exam. So if you are a nurse practitioner student going to take their test, I'll have all of the information regarding my review course in the description box below, and you can go ahead and check that out. And then finally, I just started a new channel here on YouTube called Brittany Vlogs, where I get to be a little bit more casual and creative over there. It's not educational content. If it's something that you're interested in, I'll go ahead and link that channel as well in the description box below. I'd love to have you join me over there as well. All right, so now that we got the introductory part of the video out of the way, let's just get into the content. So today is the second video of this series where I'm talking all about different rare diseases. And today I'm going to be talking about EHLERS-Danlos syndrome. And this syndrome specifically is near and dear to my heart. I do have a family member with EHLERS-Danlos, and so I found it very interesting to go ahead and just learn a little bit more. And I'm excited to share the information with you guys as well, because you could definitely encounter this in practice. And so I think it's always good to expand our knowledge. All right, so before I actually get into the meat of the content, if you could go ahead and like this video and subscribe to the channel, it really helps me out and I definitely appreciate it. So thank you guys for your continued support. I do appreciate it so much. All right, so let's just get into EHLERS-Danlos syndrome. All right, so EHLERS-Danlos syndrome, or EDS for short, this occurs in approximately 1 out of every 5,000 persons, and it's really an umbrella term used to describe the 13 variations of EDS. So EDS is actually a group of genetic disorders. It involves the skin's hyperextensibility, joint hypermobility, and then tissue fragility. In the majority of EDS types, genetic mutations affect the individual's collagen, which then in turn can affect a variety of things like skin, tendons, ligaments, vasculature, the skeleton, even a person's eyes can be affected by these mutations involving the collagen. The 13 variations of EDS, they're listed here on the screen for you to go ahead and review. The hypermobile type of EDS, this is the most common form, and it accounts for about 90% of all EDS cases. Following the hypermobile type, the next most common forms would be the classical and vascular types of EDS. So in this video, I'm going to focus on the hypermobile variation of EDS because that is the most common type, and I think it would just benefit us most to know about this type first. Maybe in future videos we'll go over other types, but for today, I'm going to be focusing on the hypermobile variation of EDS. So in general, hypermobile EDS patients, they present similarly to other individuals with EDS. However, their symptoms, they tend to be a bit more mild. Hypermobility in itself is relatively common. However, with hypermobile EDS, other comorbidities, complications tend to coexist with this physical trait, if you will, of hypermobility. And interestingly, although EDS is classified as a genetic disorder with, like I mentioned, disruptions to the synthesis and processing of collagen, hypermobile EDS actually doesn't appear to have a structural abnormality involving collagen. And currently, no genetic markers have actually been identified. So this kind of leaves the hypermobile type as a bit of an anomaly. All right, so let's talk about how patients with hypermobile EDS present. So the most prevalent feature of the hypermobile type include the following. So there's joint and spine hypermobility, recurring joint dislocations. This is often involving either the shoulder, the patella, the kneecap, or the temporomandibular joint. Also recurrent joint sprains, ligament or tendon injuries, and then finally chronic joint pain in one or multiple joints. So those are the most prevalent features that we see with this type of EDS. Other complications that can be seen with these patients would be delayed gastric emptying, irritable bowel syndrome, and then autonomic dysfunction. And I think it'd be really actually interesting to discuss a whole video on autonomic dysfunction because this affects so many facets. But autonomic instability, it can be associated with postural orthostatic tachycardia syndrome, or POTS for short, syncopal episodes, sleeping difficulties, bilateral leg swelling with the appearance of the varicose veins, and then headaches. And in fact, about 33% or a third of hypermobile EDS patients do report suffering from some type of headache, whether it be either migraines or tension headaches being the most commonly reported. Additionally, there are generally some skin involvement as well with the hypermobile patients. However, it's not as severe as it is in some other forms of EDS. Typically, we only see mild hyperextensibility, along with some easy bruising, potentially multiple stretch marks can be seen. Also, sometimes we'll see recurrent abdominal wall hernias and pelvic floor weakness. Those can be present as well. All right, so how is hypermobile EDS diagnosed? So this is a clinical diagnosis. It's based on both the physical exam of your patient, and then also there is the 2017 International Criteria for hypermobile EHLERS-DANLOS syndrome. And a person is diagnosed with the hypermobile of EDS if they meet all of the following 3 criteria. And we're going to go through this diagnostic tool together. At first, when I was trying to review it, it was a bit confusing. And so I think it's going to be really helpful that we kind of break it down. All right, so like I said, they need to meet all 3 criteria. So this is the first criteria, this slide here. So they need to have generalized joint hypermobility based on the Baton hypermobility score and the 5-part hypermobility questionnaire. And so the Baton scoring system here, actually I'll put up on the screen a really great visual depiction that I took from the EHLERS-DANLOS Society website. I can't take credit for this. This is just such a great visual. So the Baton hypermobility scoring system, it's looking at 5 criteria. Is the patient able to passively dorsiflex their 5th metacarpophalangeal joint by at least 90 degrees? If yes, they can get up to 2 points because they can get 1 point for the left side and then 1 point for the right side. The second one is, are they able to oppose their thumb to the volar aspect of the ipsilateral forearm? Again, if yes, they can go up to 2 points, again, because 1 for the left, 1 for the right. Is the patient able to hyperextend their elbow by at least 10 degrees? And then once again, they get up to 2 points, 1 for the left, 1 for the right. Is the patient able to hyperextend their knee by at least 10 degrees? If yes, 1 for the left and 1 point for the right. Again, maximum of 2 points. And then finally, is the patient able to place their hands flat on the floor without bending their knees? And if yes, if they're able to do this, they can get 1 point. And so the patient can get a maximum of 9 points, with 4 or more points indicating generalized joint hypermobility. And so, yeah, again, just review this picture here. I got it from the EHLERS-DANLOS website. It's such a great tool. And then that other tool mentioned to help classify the hypermobility is the 5-part hypermobility questionnaire. And then you can see the questions there on the screen as well. All questions are answered either with a yes or a no response. So the first question reads, can you now or could you ever place your hands flat on the floor without bending your knees? The second question, can you now or could you ever bend your thumb to touch your forearm? Question 3, as a child, did you amuse your friends by contorting your body into strange shapes, or could you do the splits? Question 4, as a child or teenager, did your shoulder or kneecap dislocate on more than one occasion? And then the final question is, do you consider yourself to be double jointed? And so answering yes to either 2 or more of the questions here on this questionnaire can also indicate that generalized hypermobility. And that again is criteria 1. All right, and so here is the second criteria that's required for the diagnosis. This criteria is that the individual must fulfill 2 out of 3 sections listed here, and they're listed as A, B, and C. So they need to make 2 out of 3 of the sections. And so we're going to go over A, B, and C. So features on section A, these are manifestations of a connective tissue disorder. The patient needs to have 5 out of the 12 findings to fulfill this section. So in order for them to get section A fulfilled, they need at least 5 of the 12 findings. All right, so let's read over these really quick. So the first one is unusually soft or velvet-like skin. Second one is mild skin hyperextensibility. 3 is unexplained striae, that's stretch marks. Number 4 is bilateral pyogenic papules of the heel. I wasn't sure what this was, so I included a picture there. You can see the picture of the heel. And these are actually soft, Skin-colored papules are found on the feet or the wrists, and they are the result of fat herniating through the dermis. And so that is an indicator for some connective tissue disorder. And then the fifth one is recurrent or multiple abdominal hernias, and they get 2 points for this. 6 is atrophic scarring involving at least 2 sites. 7 is pelvic floor and or rectal prolapse. 8 is dental crowding and high arched or a narrow palate. 9 is mitral valve prolapse. 10 is if they have an arm span to height of 1.05 or greater. 11 is I don't know if I'm going to say this correctly, but arachnodactylial. I pulled up a picture. You can see the hands there. It's a condition where the fingers are long, slender, and curved, and they're supposed to look like the legs of a spider. Hence, the root word is the word arachnid, which is from the word spider. But it's just long, slender, curved fingers. And then finally, 12 is aortic root dilation with a z-score of greater than +2. Again, in order for them to have feature A, they need to have 5 or more of those 12 findings. And then feature B, so it states that the patient has to have 1 or more first-degree relatives that meet diagnostic criteria for the hypermobile type of EDS. So if they have one of those first-degree relatives, then they would have that feature B. And then feature C, these are musculoskeletal complications. So there are 3 of them listed here. They need to have at least one of the 3 findings. Number 1, daily musculoskeletal pain in 2 or more limbs for at least 3 months. 2, widespread pain for 3 or more months. And then 3 is recurrent joint dislocations or joint instability without the presence of trauma. Obviously, that's very important. So they need 1 out of 3 of those findings for them to classify as feature C. So they need to either have feature A and feature B, or feature C and feature B. You get it. They need to have 2 out of the 3. All right, and then finally, the third criteria for the diagnosis of hypermobile EDS is that there has to be no evidence of some other connective tissue disorders or causes for the symptoms that they're experiencing. So currently, there are no diagnostic tests that actually establish a diagnosis of hypermobile EDS. We're using our physical exam and this diagnostic tool here. So there are some features that we should keep in mind that would suggest an alternative diagnosis. So those would include low muscle tone, height less than the 3rd percentile, if they have hand or foot deformities, if they have unusual skin fragility, if they have severe bruising and hematomas, and then also if they have intellectual disabilities. All of those would indicate to us that there's maybe something else going on with these patients. All right, so now that we went over the diagnosis of the hypermobile type of EDS, we should discuss treatment options. So currently there is no cure. Treatment is individualized. It's based on the patient's specific symptoms. So generally these patients, they can be effectively managed by their primary care, and then they are referred to specialists as needed. So this could include physical or occupational therapy, potentially medical or surgical specialists. It's depending on their symptoms again. For example, if they're experiencing those abdominal hernias, they might need to see a surgical specialist. The physical and occupational therapy, these are really important to help manage pain and musculoskeletal issues. These support services, they can also help to make sure that patients have access to the necessary assistive devices to help them function and to, of course, improve their quality of life. Treatment for these patients is all about improving their quality of life. The literature also recommends that the patient is referred to a pain specialist if they are suffering from debilitating pain or pain that lasts longer than 3 months. Before referring to a pain specialist, of course, the primary care can attempt to manage their pain using either simple analgesics or NSAIDs. Also, there are certain antidepressants, certain anti-seizure medications, or even muscle relaxants that are used in the management of chronic pain that can also be effective in managing the pain associated with the hypermobile type of EDS. And then patient education. This is the foundation for managing patients with hypermobile EDS. It's really important that they receive education on their diagnosis, and that we even provide information regarding various supportive organizations for the Ehlers-Danlos syndrome diagnosis, so they're not feeling so alone or so isolated. And so there is the Ehlers-Danlos Society. This is the website, the EHLERSDANLOS.com. There's a lot of information on there. I just quickly reviewed it, but you could just refer them to this website and they can look. They have different online support groups, and I believe there's just different resources there for them to connect with other patients that also have EDS. All right, so that is going to complete today's video. Hopefully you feel a bit more aware and acquainted with Ehlers-Danlos syndrome. So if you do encounter in practice, you'll have a better idea of that patient and their diagnosis. If you have any rare diseases that you'd like to hear me cover, definitely go ahead and leave them in the comments below. I might do those in my next upcoming videos. I'm definitely looking for recommendations of things that you're interested in learning about. Also, if you enjoyed the video and you learned a little bit, don't forget to like the video and subscribe to the channel. I really appreciate it. I think that's going to be it for today. Don't forget to learn something new every day, and I'll talk to you guys very soon.